Well, thank you very much for joining me. This is the Healing at the Speed of Light podcast. My name is Jason Roundtree. I'm a chiropractor and a certified medical laser safety officer, and this is Christy. Christy is a certified laser tech, and we are here to talk to you about science.
Science can be fun.
Science can be fun. It can also be really, really super difficult to understand depending on the researchers, the way it's put together.
Right.
But if you are looking at medical care, healthcare, and dealing with pain, science is the way to go.
Right.
Because guessing doesn't get anybody anywhere.
No.
And so the best thing we can do is look to the science and see what has been shown to work, what has been shown not to work, and then how do we apply that to our own lives. So as patients, if you are dealing with low back pain, tonight's the night we're going to talk about low back pain and how laser therapy can work and how physical therapy can work as well. So, but in order to do that, we're going to be going back to a research article and talking about that in a way that makes sense. That's our goal.
Right. And if you're really wanting to know more information, the link to the article will be in the show notes.
Absolutely.
So those who really desire to dig deeper, go for it.
Absolutely.
But
yeah.
Dr. Roundtree will make it simplified.
I'll try to make it simple and quick and something you can actually do something with. I will admit I had a little bit of a hard time understanding some of the results that these researchers were explaining. So I made some really cool visuals.
Nice.
Really, they're pretty lame, but some good visuals. I'll share those with you as we get to the end of the study here, but it made it a little bit easier for me to understand. And again, hopefully the goal here is to get patients who are dealing with pain access to this kind of scientific information so they can use it to kind of form the decision-making process for themselves.
Right. Well, we need to help people think rather than just tell them what to think.
Yes.
So.
Absolutely. Yeah, that's exactly right. There's too much of that out there. I mean, everything from do this one exercise every day and it'll make your knee pain feel better. I mean, that's not a thing. Sorry. So hopefully understanding on some of this, at least the basics of how some of this scientific data can be used, hopefully helps people make wise decisions for their health care. So, okay, so this article came out in February of 2022, so it's only a little more than a year old. It's titled Effectiveness of Low-Level Laser Therapy in Patients with Discogenic Lumbar Radiculopathy, a double-blind, randomized, controlled trial. So let's break that down a little bit right here, the first. So we're looking at low-level laser therapy or cold laser therapy or photobiomodulation. Those are all same terms for this procedure, and it does not involve burning or cutting any tissues or heat. We are simply applying very dim levels of light to the tissues, and the idea there is to stimulate change and to help with pain.
Right. Very non-invasive.
Yes.
Topical, if you will.
Yeah, exactly. Basically, think about it that way. Although the light does go deep into the tissues, you're just applying it onto the skin, and you can see some pretty amazing changes. And in this case, they were looking at it with discogenic lumbar radiculopathy. So lumbar is low back. Discogenic means that the pain is coming from the vertebral disc, and the disc is the kind of piece of supporting tissue that sits in between the bones of the vertebrae. That gives you good cushioning, gives you motion. I think most people at this point have probably heard of disc herniations and things like that, right? Right. That's what we're talking about. So pain that comes from the disc in the low back. And then radiculopathy is the last word in that title we want to talk about. Radiculopathy means it's pain that radiates. So it goes from the low back down the leg. It's
not ridiculous pain. It's a radiating pain.
Yes, it's not ridiculous. Although it feels pretty ridiculous in some cases. Ridiculously high in for some folks. So it can be really, really bad. It can be fairly mild. But what they say in the study is that pain from this kind of condition is usually located at the belt line. There's usually sharp shooting pain that runs down the low back and then down the thigh, usually the back of the thigh on one side. This pain will be aggravated by sitting, by prolonged standing, bending and twisting movements, and it always feels better to walk or lie down and rest. So, if you're having symptoms like that, it's possible you could fit into this into this group, this lumbar radiculopathy, discogenic lumbar radiculopathy.
Somewhat similar in ways to sciatic pain.
That's exactly right.
So you need to get it checked out. You need to have people look at it.
Yes.
So.
Yeah, sciatic pain is exactly what this is actually. So, however, you can have a couple different causes of sciatic pain. So in this case, they're saying specifically that the disc, the lumbar disc, is creating this sciatic pain that runs down the back of your leg. You can have muscle issues and nerve inflammation. There's a few different things that can cause this sciatic type pain. So if you have sciatica, you know, it may be a little bit different for you than what we just described here if it's not coming from the disc.
Okay.
But the disc is one location where this can be originating from for sciatic. Yeah. So this lumbar disc prolapse is where the disc kind of becomes injured and part of the inside of the disc pushes out. The problem is when that pushes out, it pushes towards the nerves that then run down the leg. So you get some pressure or irritation, inflammation in that nerve, and then you end up with pain that goes down the leg. Even though the leg isn't injured, injuries in the back because it's pushed up against the nerve, that's why you feel that. Now, usually that's pretty limited and short term. You know, a lot of people will have this, and then a couple days later, they're basically up and moving and doing fine again. This study looked at patients who had really severe and moderate to severe pain that was not going away rapidly.
Okay.
It was still acute, like it had just started recently, but it wasn't just gone in a couple days like some of these cases.
Okay.
Now, the regular treatment approach for this is doing anything you can really to help that disc relax a little bit and to decrease inflammation. So really commonly, people will be put on bed rest for a couple days. Anti-inflammatory drugs like ibuprofen can be used, muscle relaxants, electrotherapy, therapeutic exercises, soft tissue, lumbar corsets, they say, which I think they mean braces. It's a Pakistani study, so they've got some different words in here. Laser therapy, or as a last resort surgery.
Okay. I want to throw something in because we talk about this. What about, heat and ice? I mean, that's another thing that people just tend to, need to put the heating pad on.
Right.
This pain.
Yes. Actually, I'll have to push off the answer to that question just a little bit because we do get into that here in just a minute.
Okay.
But
spoiler alert.
No, that's good. That's good. They don't happen to mention it here, but that absolutely is something that a lot of people will end up doing, yes.
Okay.
Now, these researchers wanted to see how laser therapy worked for this type of pain. So they said that laboratory studies show that laser therapy modifies the inflammatory process and thus relieves painful symptoms produced by disc lesions. So this modification, this change in the inflammatory situation, is brought about by a decrease in nerve conduction. That's your number one. So that means that laser therapy actually slows down the rate at which pain signals travel to your brain.
Okay.
So right off the top, we can bring pain levels down by basically slowing down those nerves. Now, it doesn't affect your other nerves, right? It just diminishes how much pain sensation you get sent. Secondly, it also engages the release of endogenous opioids, things that make you feel good. It also gives you an increase in angiogenesis. Do you know what angiogenesis is?
I should, but I cannot bring
That's fine. I guarantee most people don't know. The angiogenesis.
I mean, I've heard of it.
Yeah.
So
genesis means beginning, right, or new.
Right.
And angio has to do with vasculature. Blood flow. So this is the creation of new blood vessels, angiogenesis. Laser stimulates that.
Right.
And then because of all those effects, you get an increase in local blood flow to these damaged areas, which damaged and inflamed areas need good blood flow if they're going to be able to repair, regenerate, replace damaged tissues, bring pain levels down, the whole bit, right?
Right.
So they're saying that laser does all of that. There's some other effects there I'm not going to get into because we're already kind of deep in there. If you want to know more about how laser works at a cellular level and molecular level, you certainly can dig into some of the other podcasts we've done on it. Suffice to say that it brings down inflammation, it reduces pain signals, and it stimulates healing.
That's it in a nutshell.
There you go. So the researchers wanting to know how laser therapy works out for low back pain, they took a lot of patients, a pretty large number of patients from 3 different hospitals, and they put them in this program where they would work with a physical therapist, and they'd have physical therapy 3 days a week for 6 to 8 weeks. They'd end up with 18 treatment sessions overall in, a couple of months. And so the one group of patients had just physical therapy, in which they would start with a hot pack.
Okay.
There it is.
There it is.
So that's a very commonly used, tool, especially in PT. But generally, what we believe at this point is that ice is going to slow down and hold back healing, whereas heat does not slow down healing. And it usually feels pretty good. So encourage people to do hot packs in most cases, unless it's something that just happened, right? You just rolled your ankle, go ahead and ice it first.
Right.
So they'd get hot pack, then they'd do some back extension exercises, they'd do some leg raises and things like that. Pretty standard physical therapy exercise piece. So that was one group. And then the other group would get all that, but they also got a couple minutes of laser therapy. And for this laser therapy, they used a very, very weak laser, very, very low intensity, and they just put a little bit of laser into these areas. Just a little bit, where they knew that these patients were having a disc problem.
Interesting.
Yep. So it didn't take long at all. It was about 2 minutes of total time in each treatment, so it doesn't take very long. Again, no heat, we're not burning or cutting anything. It's almost like using a little eyedropper of photons. You're just barely dripping a little bit of light in there, just a tiny bit.
Interesting. Very interesting.
So those were the 2 groups. They ran that for a total of 18 visits. And they did come away with some interesting results. So I want to show you those, because they're a lot easier to show than they are to really talk about. But I'll try and describe them also. See if it'll work. There we go.
There you go.
Okay. So when it comes to pain, both groups, the PT and the laser plus PT groups, both groups started off pretty high, and both of them got remarkably better. The laser therapy group got a little bit better than the PT group, but not by a huge difference.
As the laser group, the red line?
The laser group is actually the blue line.
The blue line.
So they went from pain, way up here, down to from a 7 out of 10 to a 1 out of 10.
Okay.
And the patients in the PT only group went from a 7 out of 10 on average to a 2 out of 10.
Okay.
So still very good improvement with both.
Mm-hmm.
Yeah, just a small difference there in favor of laser. There we go. The disability levels were measured also. And again, both groups had good reduction of disability. Again, a little bit in favor of the laser therapy group. They got a little bit more ability throughout this course of care than the folks who did not get laser. And then lastly, the amount of forward bending, so flexion in the low back, how much they could bend. And this case was actually pretty darn good in favor of laser. So both groups started off with a decent amount of restriction. They couldn't bend forward very well. And by the end of it, they both had some very, very good improvement. But again, a little bit more improvement in the laser therapy group.
Oh, laser wins.
Laser does win. Laser wins. And really, that's our takeaway today that's important, is that PT can work extremely well.
Oh, definitely.
Exercising is a great thing.
Still key.
Absolutely. Absolutely. If you had taken away the exercises from this piece, I have the feeling we might not be having the same result.
Both and.
Exactly. Exactly. I will say these results were a little bit less than I kind of expected. A lot of these laser studies that we see with low back pain show a bigger difference between the groups. And so I think part of what might have held these guys back a little bit is that they were using such tiny amounts of light.
That's what I was going to just say. It's like a little bit more might be helpful. I mean, more is not always better in the case of laser therapy. I mean, we know
that's
that.
Exactly
it's got to have the right dosing, the right wavelengths and that sort of thing. But In this case, I was wondering why it was so little.
Right. Yeah. It is kind of interesting to me too, and they even do mention another study that was done with even less light that got no results. So it seems like they kind of just are entering into the zone where they can get some results. But again, it's almost like using a little eyedropper for their photon, just barely putting it in there. Whereas most of the time when we're applying laser to low back or any deep tissues like the hip joint especially, we're kind of taking the picture and just pouring it on there because we need more of that light to get in deeper. And so typically what we see is even more significant results than what the researchers saw here. But still, the point is, I don't care what kind of laser it is, it's better than not having it.
Better than not.
Yep. It's not going to hurt.
Well, it doesn't hurt.
No. No.
It's non-invasive. I mean, maybe a little bit of warmth.
Right.
And maybe achiness when you're done.
Yeah.
Temporarily.
So. Yep.
But that's because your body's working. Your body's working to heal itself. And we're stimulating that repair.
Right.
So.
I hear a lot of people, they'll liken it to post-workout soreness. You know, we're like, I felt like I went to the gym, but I didn't. You know, that's exactly right, because we're getting more circulation into those tissues, and it happens at quite large volume if you use a lot of laser. So, really, if you've got back pain, if you've got it from a disc, the biggest thing I can tell you is please give the conservative care a try first.
Don't ignore it first.
Right. Don't just go straight to surgery. Most people who go through surgery for a low back disc problem will continue to have problems. Don't think that it's just going to magically make all your things go away. The likelihood is you will have ongoing issues afterward. And there are many cases that go through physical therapy, chiropractic, conservative care that do extremely well and get complete recovery. You know, even with severe pain like these patients had, all of them improved very well with physical therapy, and then physical therapy plus laser. So get some PT, get some chiropractic, get some laser if you can.
Right.
And any laser could be very, very helpful. Even minimally helpful is still moving the needle in the right direction.
Right. Exactly.
If you want to know where to get the best laser therapy, we're going to tell you to go to our website, lasertherapyinstitute.org. You can go to the tab labeled clinics. There is a whole map of our clinics there that you can check out, see who's near you. If you're having a hard time finding laser therapy providers near you, you can also email us, and we will try and help you out. Our email address is info@lasertherapyinstitute.org. And if you've got a doc, a chiropractor, or a PT who's interested in learning how to apply laser therapy, that's what we do here at Laser Therapy Institute. We train doctors and healthcare providers in how to provide the very best laser therapy to help the patients get better faster.
Right. Exactly.
Thanks for joining us.
Thank you.